All right. Well, thanks everyone. Appreciate your time today to talk about Evolve. My name is Spike Cheever. If I haven't had a chance to meet you yet, and I'm currently serving as the president of Evolve. And I'm grateful for the chance to kind of talk about Evolve and ultimately what we try to do here. Going to my first slide, this kind of gives you the meat and potatoes of why we exist and what we do. But our sole purpose is to help make aging in place safe, and coined with that or coupled with that is really we try to help take care management out of construction. There's been a big trend in Medicaid over the last decade or so, 8 to 10 years, and it's a growing trend on the Medicare side to help have some ancillary type services rolled into home and community based services that aren't necessarily related to a traditional healthcare type background. And so we're asking care managers, which usually are registered nurses, to help coordinate things like construction related services or vehicle modifications, pest control, something of that nature. And that can be a difficult road to navigate. And so that's where Evolve steps in as a benefit manager to help be that translator in the process and to help both the provider type and the health plan understand expectations and the roles in the process also. So a little bit about what we do from a service coordination perspective. Here are some of the services that we specialize in, namely home modifications is the most popular one. But chore services includes things like pest control, lawn care, snow removal, something of that nature. Assistive technology. This is where we take a dumb home and turn it into a smart home with Wi-Fi enabled devices that can improve a member's activities of daily living. That also might include automating aspects of the home, like automatic door locks or light switches, timers on lamps, stuff like that. You're even providing some monitoring type services for loved ones who may live across town, something like that. We also help address vehicle modification needs that can help improve a member's ability to get to their doctor's appointments, perhaps their primary care physician or dialysis, something of that nature. It can include rear of vehicle wheelchair lifts, excuse me, as well as like hand controls or restraint systems within the vehicle itself. Moving assistance, that's where we are taking individuals and we're moving them back into the community and taking their possessions with them. Memory care security. This is a supplemental benefit that we offer with a couple plans to help with individuals who may have Alzheimer's or dementia and also may be deemed a flight risk, that have localized alarms or monitoring type systems within the home that help caregivers and loved ones know when at the entrances and exits of the home are breached, so they can keep an eye on that individual and make sure that they're not going into harm's way. And then asthma remediation. These are services that help to reduce the triggers of asthma, mainly in California with Medi-Cal, but it can include things like eliminating the shaggy carpet and putting in hard flooring surface, installing standalone air purifiers or air conditioners within the home as well. But it could be like an overhaul of their HVAC system and then being able to address those things that typically would result in an ED visit or even a hospital admission. So our focus is the actual home and the environment where the member lives, while the health plan can then focus on the more traditional medical type services of the member and get those taken care of, and ultimately help the member reside more happy and healthily within the home. A little bit about us and who we serve with these types of services would be Medicaid and Medicare Advantage populations. The majority of that is on the Medicaid side. It is encompassed over, it's actually closer to a little over 20 different national and regional health plans and state programs across 7 different states. And on an annual basis, we receive a little over 2,500 requests for those types of services previously shown on the last slide. Some of the plans that we represent from a national perspective would be Anthem or Elevance, depending on the market. There's a few Anthems still out there. Humana, Molina, and Aetna as well. And it's humbling when your customers come to you and ask you to move across state lines. So we have the great privilege of growing with these plans organically as they need us in these different markets. But from a health plan perspective, and what I mean by benefit management, some in this group might refer to it as a vendor arrangement or even a subcontractor agreement, which the terminology is very synonymous. But as a benefit manager, we are really managing the full benefit from start to finish. And it starts with finding these providers and being able to credential them, educate them on the process, the opportunity to work with this vulnerable population, and ultimately make sure that these provider types are safe to be entering the member's home, that they're qualified from a work history standpoint, and that they're eligible to receive state and federal funds. And then there's no issues from that regards. All while navigating their inquiries on an actual request basis and translating that over to the healthcare side, or perhaps intaking the questions from the care managers and translating that back to the providers as well. We also help to oversee some fraud, waste, and abuse on behalf of the plan too. Not only from a provider perspective, but from a service perspective, and making sure that the services that are rendered match fair market pricing, and that members aren't what I call adding to the shopping list and requesting things that, one, aren't medically necessary, but two, go above and beyond the requested scope of work from the plan. And then we help to manage it from an estimate process with those providers to help them understand what is medically necessary, that we try not to entertain member preferences. We want to include those, but this is a publicly funded program. And so if a member is going to be requesting things like marble or travertine within their bathroom, as opposed to ceramic or porcelain or even a fiberglass insert, that's when we have to try to rein it back in with not only the member, but perhaps the provider as well, and educate them both on the purpose of this program to meet those medical necessities. And then provider payments. One of the most challenging issues with this provider type is getting that provider type to fill out a clean claim submission of a HCFA 1500. They're simply just not used to all of the medical jargon that's necessary on that form. So we actually submit the claim on behalf of those downstream providers to the plan, so they have the encounter data that they need, and then we pay that provider in accordance to a typical business transaction that they're used to. And then the actual request oversight, which pairs back into what I was referring to a few slides ago with the actual home modifications, scheduling it with the members, make sure members are satisfied with the completed work, and receiving the products that they ultimately need for the long-term care of their loved ones. So that's pretty much it, short and sweet in a nutshell. But if you have any questions, feel free to send me an email or call me, but I'd be happy to address any questions that you may have right now. So thanks, everyone.